Hello, everybody. Today we've gathered for an important podcast on obesity, its treatment options, a special focus on bariatric surgery. I have my colleague here, Dr. Saurabh Misra, who's a renowned bariatric and robotic surgeon at the Apollo Hospitals, Bannerghatta, Bangalore.
Thank you, Dr. Anusuya, for having me here on the podcast. I am Dr. Saurabh Misra. I am a consultant gastrointestinal surgeon, bariatric and robotic surgeon at Apollo Hospital at Bannerghatta Road. And this topic is very close to my heart. I've been practicing bariatric surgery and obesity related diseases for almost 2 decades now.
Can you help our audience understand what obesity is from a medical perspective and what causes obesity?
It is actually a very complex medical condition which is chronic. It is characterized by an excess amount of weight in the body. Now, this excess amount of weight produces a huge amount of other issues. Technically speaking, the BMI is an indicator of your normal weight, if you are overweight or you are obese.
So, is BMI the only indicator of obesity? Like if you take it in Indians, a waist hip ratio is a better indicator than a BMI, isn't it?
Absolutely. I would agree with you because BMI has its own flaws. BMI does not tell you where the fat distribution is. The other problem with BMI is that it does not take the muscle mass into consideration.
Sure.
So what you will have is the athletes with a very high BMI, and they would not be called obese, but they are fit guys. So a better indicator would be a waist circumference and a ratio which is probably weight to hip ratio. Then there's another indicator now that which we are using very often is the body percentage, body fat percentage. And there are a variety of ways you can do it by DEXA or meter and all that.
Yeah, you can use a simple slide calipers also to use
Yes,
it.
that's one of the things that we use. So they are more accurate because we know that having fat around the tummy is more likely to get you into severe health conditions than fat which is distributed around the hip or overall.
Yeah, so if you take an Indian scenario, it's usually if you see the typical Indian male, he's lean everywhere, but the obesity is around the truncal area.
Absolutely. So, what has happened is over these years we have realized that the South Asian genes is not as robust in holding on weight or fat as the other Americans or European counterparts. So we tend to get health-related issues in a much lower BMIs because of the fat distribution. So most of these people would have fat distribution around the tummy, and the visceral fat would be too much, causing inflammation and the related problems.
So, just for the audience sake, what is visceral fat?
So visceral fat is basically the fat which is in and around your internal organs. Let's say
the non-visible fat.
Yes,
the non-visible fat.
So
yeah.
If you have a liver which is having a lot of fat, it would cause a lot of inflammation in the liver, causing it to dysfunction. So that's where the fatty liver and NFLD kind of diseases happen, and they may sometimes lead to serious issues like cirrhosis.
So NFALD means non-alcoholic fatty
Absolutely.
liver.
Absolutely.
So do you think that obesity is just an aesthetic issue, or there are other health complications which are related to obesity?
I'm glad that you asked this because there is a big perception issues among the people by and large that obesity is just the looks. What happens is most of the people who are overweight, obese would probably end up seeing a plastic surgeon instead of a bariatric surgeon.
Yes.
So basically, obesity, it's a disease. And 2014, the American Heart Association and the WHO, as well as Canadian Heart Association, characterized it into a disease. The reason being that a lot of it, over these years, we have realized a lot of issues with obesity is not in your control. So it's not just lifestyle issue, it's not just an aesthetic issue, but it's a lot more.
So it affects your heart, your liver,
Absolutely.
your brain, and many other organs if not taken care of.
So there are about 200 of these diseases which are directly or indirectly connected to obesity. In fact, a lot of we know about the diabetes, hypertension, cardiovascular diseases, but there are huge amount of other diseases like the PCOS,
Yes.
as well as the the psychological issues, and more than that, the cancers, the
Yes.
breast cancers, the
True.
esophageal cancers, the colorectal cancers are directly or indirectly related to obesity.
True. So, from a physician point of view, since I'm a physician, we see a lot of cases of metabolic syndrome. So, what is metabolic syndrome?
Um, Metabolic syndrome is basically connected to obesity itself. So
Yes.
it's a complex group of disorders which would lead you to a higher chances of developing serious other diseases. So if you have, there are five components of metabolic syndrome. Um, a belly fat, which is more than about 100 centimeters, and if you are uh, diabetic, or you are on anti-diabetic drug, or you have your blood sugars are more than 100. If you're hypertensive, you're on hypertensive medication, or your blood pressures are more than 130 or over 85. Then there is your triglycerides are more than 150.
50. Yeah.
And your HDL levels in males, it is less than 40,
40.
and females it is less than 50.
Mm.
All these three of these parameters, if you have, then you're likely to be having what is known as
Yes,
metabolic
metabolic.
syndrome.
So, is obesity connected to metabolic syndrome?
Absolutely.
True.
Because what's happening is you have an individual which has got a lot of belly fat. It produces a lot of inflammatory hormones, causing a lot of peripheral resistance to insulin, which is causing in turn more insulin in the body, causing more and more accumulation of fat.
So, this inflammation itself is a cause for most of these metabolic diseases like your hypertension, diabetes, and other things. So, let's now dive into what are the non surgical treatments for obesity.
So, the cornerstone of treatment of obesity is always diet
And exercise. Yeah.
They form the basis of treatment of people who want to lose about 10 to 15% of the body weight.
True.
And it also is a very big component in patients who want to lose a larger amount of weight, or they have undergone bariatric surgery, or they are on medicine or medications for treating obesity. So this forms one of the very important pillars.
Cornerstone. Yes.
To address those issues and keep them. So maintenance issues are very important here.
So, how effective is diet and exercise only in the treatment of obesity?
So, like I said, about if you want to lose about 10 to 15% of your body weight, and it's just around 10 to 15 kgs, it's very effective.
Okay.
So, what you do is typically we recommend patients to cut down their calories to less than 100. Sorry, less than 1,000. And your exercise levels, which were normally about 150, you should increase to about 200 to 250 minutes
in a week. Per week. Yeah.
If you want to actually lose weight. But then, of course, there are issues with it. Why it is not effective?
Then why do so many people, in spite of maintaining a healthy lifestyle, still struggle to lose weight?
That's the biggest issue with obesity.
Yeah.
So obesity is a multifactorial problem. Looking at just one aspect of it will not cure it.
True.
So what's happening is that now, over these years, we have realized that obesity is a very complex issue. So one is obviously the
Lifestyle.
energy imbalance. So you have more intake than output, and whatever is not used is put back into the body as fat. So that's only one aspect of it. The second aspect is the gene. So now we know that there are genes which actually specifically look after how the body stores fat, how much hunger you have. So there are genes called the MC4K or MC4R gene, and there is FTO genes which are specifically related to this.
Okay.
So we'll talk about the gene, how are we managing genes in future.
Okay.
So one of that's the second thing. Then there are psychological issues. So people with emotional disorders go on binge eating. So they have a very good diet plan and everything is going accordingly.
And then one day
they have
all goes haywire.
Yeah, and then that's the binge eating or the binge drinking kind of thing which goes on. Then there are the medicines. A few of them are on medications which are really obesogenic. So you must be treating a lot of these patients who would be on thyroid medication or PCOS.
True.
So they themselves, and antipsychiatric drugs, so many antipsychiatric
all of them
drugs
cause weight gain. Yes, true.
So that's one of the aspects. Then there is a lot of talk about the set point theories. So what's happening is that the brain accepts a certain kgs or certain set point of your weight and accept it as the normal weight. So if you are 150 kgs,
so that's your normal weight.
Your
normal
brain
weight
accepts as that normal weight.
True.
And then what happens if you try to reduce it? It
Again,
will
the
go into a
thermostat
panic mode. So it will say, no, you're going into famine state.
Yeah.
So what it will do is it start to reduce your resting metabolic rate. Your leptin levels are going to go down. Your ghrelin levels are going up. So that's doing something at a very, very hormonal level, which you have absolutely no control on.
So how do these new age drugs which have come out now? There's Ozempic, which has become a blockbuster in India also now, but we don't have it in India. How do they work for obesity?
So basically, Ozempic and semaglutide is what the drug was basically for treating diabetes.
Yes.
So there is a hormone called GLP-1 hormone, which is basically which causes our satiety and decrease in gastric emptying. So anyone who's taking these medications would have feeling that he's full all the time, and so he would feel less hungry basically.
Yeah.
So GLP-1 also helps you to control your diabetes, your blood sugars, and things like that. So it's actually become quite a fad around the world because people think that it's kind of an easy way out.
But even with taking Ozempic, it doesn't mean that you take Ozempic and then eat what you want, right?
Absolutely.
You have to maintain your lifestyle even otherwise.
So basically, may it be drugs, may it be surgery, or may it be just lifestyle change. You have to look at the bottom of it that these are all tools.
Okay.
And the tools come with an instruction.
True.
So if you don't
follow the instructions,
the tools are unlikely to work for you.
So for that subset of patients who are unable to lose weight in spite of a lifestyle modification, in spite of undergoing a good diet, and then went into medical therapy with your Ozempic and other drugs. Ozempic, by the way, is not available in India. For them who are obese, probably a BMI, we use a BMI as an indicator for obesity, a BMI greater than 30, what would be your recommendation for such patients?
So what happened was in 2018, that's the first time the government of India came up with certain guidelines. So the guidelines are basically to help the obesity patients decide if they want to get bariatric surgery or not. So worldwide, the cutoff limit for that was 35.
The BMI of 35.
35 and BMI of 40. But in India, it was cut down to 35.5 because we people as Indians tend to suffer from diabetes, hypertension at a much lower BMI.
Okay.
So the first time the Indian government actually came up with a guideline that at 32.5 BMI, a person could undergo bariatric surgery if he has other issues like diabetes and blood pressure.
32.5 is the cutoff.
So, going to your original question, so what will happen is that if you are, for Indians, if you are above 24.5 BMI, you are overweight.
Yes.
And for world, 30 BMI is the cutoff. If you are over that, you are an obese. But for Indians, it is 27.5 BMI.
So 27.5 BMI becomes categorized as overweight in India.
Yes.
Obese. Obese. 24.5 becomes overweight. Okay.
So for those category of patients who really don't fit into that criteria, between 27 to 35.5 BMI, they are on the gray area.
Okay.
Those people can be really helped with diet, exercise, drugs, and proper counseling.
Okay.
Looking at various things, what is actually going on and why are they gaining weight? What is happening? So just a small thing like a sleep, maybe a little bit of stress, maybe absolutely a sedentary lifestyle. A lot of things that we really don't take it we take it for granted every day. We do it. That's what causing obesity.
True.
So talking to a good healthcare professional who understands your obesity and would be able to help you is a very good idea to start with.
True. So now that we've come to the surgical part, what exactly is bariatric surgery, and whom do you recommend it for?
So, so bariatric surgery is the last resort. You should understand that, because it comes with risk. So after you have exhausted all the other ways of losing weight,
True,
and you know that your target weight is more than about 15 to 20%, and it's like you want to lose about 40-50 kgs. It's unlikely that diet and exercise will work. We have now the data of almost 100 years, and we know that it's about 99% failure rate in not reducing the weight, but it's maintenance which is an issue.
True.
So those people who have had weight loss are not able to maintain it because of certain reasons. So that's where bariatric surgery comes in.
So there are a lot of patients who actually lose weight with diet and exercise, and after a certain point, they go into this rebound.
Yes.
It's just a few years, and they've got back that same 20-30 kilos back. Are these patients ideal candidates for the bariatric surgery?
Yes, a lot of them have number of attempts at weight loss, and they have not really done well. And we know that it is not because of only the diet and exercise they are rebounding again. It's because of multiple factors which are
active. Yeah.
So these patients would be really benefited from surgeries, not only because surgery is effective, but because their mindset now is set that I want to undergo this surgery, and I'm okay with whatever comes with it.
Okay.
So it is like another tool which comes with the instructions, and you have to
follow those instructions for it.
If you have a commitment, then the bariatric surgery does awesome.
Okay. So just tell us the various forms of bariatric surgery for the lay public.
So bariatric surgery are basically three types of surgeries. One is a restrictive surgery.
Which means?
Which means that you just restrict, you staple the stomach and you reduce the
size of the stomach
so that a person is able to eat less at a time.
Right.
That's simple. Then there is a restrictive procedures, and there is a combination of these restrictive and malabsorptive procedures. So the malabsorptive procedures are usually like the gastric bypass surgery, where you eat less because we have made the stomach small. But then we make certain changes in the intestine, so that now there's certain part of the intestine is not involved in the digestive process at all. So what happens is that when those parts are not involved, the amount you eat and the amount it's absorbed is even lesser.
So you mean to say you first you make the stomach small, and then everything, whatever you eat, doesn't go down
into the duodenum and then into the jejunum.
It bypasses.
It bypasses all this and then directly is delivered into the small intestine, which has a direct effect on how the body responds. So you have at a hormonal level, you have mechanically, obviously, you're not eating so much, but there is a huge amount of hormonal change which happens in the body. So the GLP hormone goes up, and then you have the PYY hormone goes up, and then you have the whatever the insulin resistance you have immediately comes down, and it happens dramatically. You won't believe that these patients, a lot of these patients who have peripheral resistance, and we go next day to see our patients who were a diabetic a day ago, a non-diabetic are just after surgery. It's
So
that
do you
dramatic.
mean to say that the very next day post the surgery, their sugar levels are controlled?
Yes, they don't require any medications anymore.
The insulin level the usage of insulin also comes down.
Yes, the insulin. So there are criterias where a few of these patients would be cured, and a few of them would go into remission. A few of them would have a better control of the diabetes. So these are the three spectrum that we have. So if you have a diabetes which is less than 7 years, you are in a very low dose of oral medications, and you have a good amount of C-peptide levels that we can predict much before the surgery. So I can actually tell you that yes, your diabetes will go.
So
away.
basically you're saying somebody who has a very healthy pancreas, which is secreting a lot of insulin, for them this surgery works very well. Their
Absolutely.
diabetes can be
Absolutely.
reversed.
So if you have if you have diabetes which is about 10 years, 20 years, then their beta cells are all burnt up, and
For them
for them the pediatric surgery does work, but you will not have a huge amount of insulin that you have to give them, because their overall BMI has gone down. So your dosage of
Insulin comes
as well
down.
as your control of insulin becomes much better.
So if
Diabetic
your diabetes is of a shorter duration and you are obese, because obesity is linked to the diabetes, but diabetes is of a shorter duration, your chance of reverting to a non-diabetic are much more
Much higher.
than if you're a diabetic of a very long duration.
Absolutely.
Because your pancreas is basically not
Absolutely.
working, but your requirement also of insulin comes down.
Absolutely. So you may we normally tell the patients that that your hypertensive medications are going to go down, your diabetic medications may go down completely, or you may have to take a little bit of it. Your thyroid medications comes down, so you are not taking these medications, and you don't have the problems in longer term, because if you are not a diabetic, you don't have the diabetes related things after a certain age.
True.
Because diabetes causes these things after 10-15 years.
True.
So you have a kidney problem, you have eye issues, and if you have cardiovascular issues and all that, so this will be deferred to another 15-20 years.
Yeah, so obesity actually adds on to the increasing the complications of diabetes.
Yes, absolutely.
So you're more obese, the longer the duration of diabetes, and the complications again are added on to it.
Yeah.
So is bariatric surgery, what are the risks of bariatric surgery, and how can they be minimized?
Yeah. So I usually tell my patients, because they come with a lot of fear factors which have already been built up, maybe because of the media and misinformation.
But surgery itself is
yes. So what's happening is the misinformation which is going on is that the plastic surgery and bariatric surgery are the same. So we have a patient of mine came into my outpatient, and she said, "See that actress, Telugu actress, she died because of bariatric surgery. Basically, it was a liposuction surgery."
Yes.
So I'm not saying that liposuction is wrong, but what happens is every surgery comes with a risk and complication rates.
True.
So I normally tell my patients that you have the complications of bariatric surgery, the amount of bariatric surgery we do, the complication rates about 1%, 2%. It's more riskier to travel on Bangalore roads than to have a bariatric.
So doctor, how soon after a bariatric surgery do you see patients recover from it?
So typically we get the patients one day before the bariatric surgery, we run a few tests. The next day is their keyhole surgery. The next day we start orally.
So most of these surgeries are laparoscopically? There are no cuts?
Yes. Most of them are 99% are laparoscopic, but 1% who are who want a better job to be done, we do robotically,
Oh,
and that's where the innovation is in for the future.
true.
So typically they are able to take orally from the first day onwards, I mean the first postoperative day,
Hmm.
and we increase their diet uh, to full liquid diet for a week. The next week they are normally asked to take a more pureed diet,
Okay.
so which is it's a soft diet,
Hmm.
and then the next week
Hmm.
they are able to take soft diet, but they have to chew it a little bit more than they normally.
So when does the normal diet and when can they start their normal activities post a surgery?
Normally, because it's a keyhole surgery, it doesn't affect too much, and no bed rest is required. So
Okay.
normally they are able to go back to work within a week or so, and if they are able to work from home after 3 4 days, everyone I have seen, they are able to go back to the work. But I tell them to take an off because it's a stress on the body, and so they should try to get them to come up.
Could you give us some inspiring incidents of your patient success stories?
Oh yeah, we have huge. So bariatric surgery is basically a surgery where people don't want to talk about it in public, but then they share with us stories which are heart wrenching.
Yeah.
And one of them, I still remember, there was a lady who uh, was undergoing a very difficult period of a separation with her husband, and she was supposed, and she had the child, and it was a very emotional period for her, and uh, then we offered her pediatric because she was almost about 50 BMI at this point of time, and one of the reasons why they separated was this.
Because she was
She
overweight.
was very overweight,
Okay.
and then we did the pediatric surgery, and that was about 5 6 years ago, and believe me, I still see her, seen her kids grow, and every year, on a birthday, on a kid's birthday, on my birthday, she calls me up and tells me, "You are the god."
Great.
You have changed the way I look at things. You have changed the way I look at my child. Now I see that there's a future there.
So it's not only for a physical aspect, it's not only for a metabolic or a treatment part, it's also for one's psychological and emotional.
Oh, absolutely, absolutely. So I'll just share a small,
Sure.
a study which was done in the US
Huh.
when I was there at the Mayo Clinic. So they were kind of studying how the couples respond to bariatric surgery if only one of them gets bariatric
Oh.
done and the other one is not getting.
You mean both are obese, but one is
Yes.
there? Okay. Huh.
So this was published in American Journal, I think in 2006 or 2007, and then they found that if only one person gets bariatric surgery done, their divorce rates increase by 50%.
Oh, really?
Yes.
Okay.
Because now one of them is having fun.
Fine. Okay.
So
And the other one is obese.
is sitting at home watching a TV,
TV
and so the other one is kind of feeling left out, and then they would say, I want you back like you were, and the other person is not willing to go back because now she has tasted or he has tasted something
which is
which
different.
which they had not thought about. They're looking
True.
more attractive. They're going to places where they're kind of looking different.
True.
So that's the beauty of the whole thing, you know.
Yeah.
So I would normally tell people who are the couple is there. I would tell them that get one done, and then definitely you should also look at it.
How are their chances of pregnancy post this bariatric surgery? I've seen a lot of obese women who are unable to conceive come to our OPD only because they're so obese.
Absolutely.
Yeah.
So the obesity, what it does is it produces a lot of inflammatory hormones, and about 90% of obese women will not have regular periods.
Yeah.
And if they have regular periods, if they have periods, they are going to be non-ovulatory, or probably they will have difficulty conceiving. Their fertility goes down drastically.
True.
And if they lose just about 10 to 15% of their excess weight.
Okay.
Their fertility goes through the roof.
Right.
And that's exactly what we tell people when they want to have bariatric surgery, because over the period of 1.5 years, they are going to continue losing weight.
Okay.
And between this period, they cannot afford to get pregnant
Oh,
because they are already nutritionally compromised.
true.
After 18 months, the nutrition levels come normal and they are able to absorb as much as they want to. And but if before that, if they become pregnant, the child becomes undernutrition.
So typically after how many years or months post bariatric surgery should they try for pregnancy?
1.5 years.
1.5 years.
18 months is the time
Which
that
is
they will continue to lose weight.
okay.
And so they are easier to conceive, and their gestational period
Okay.
would be much better than what it would be, because they will not have diabetes and connective disorders and hypertension and things like that.
So for someone who's listening to this podcast about bariatric surgery, what particular advice would you give to such a person?
Well, if someone is looking forward for a bariatric surgery, first of all, you have to understand what you're undergoing. So you have to educate yourself. Then find someone who can tailor make the bariatric surgery for you, because one size does not fit all. So one surgery will not be appropriate for one person. It will not be appropriate for the other person. So you have to make sure that you discuss it with your healthcare provider so that they can actually tell you this is the right thing for you, because it's going to stay for you for lifelong.
So a doctor is a better advisor
Yes.
for such surgeries than just
Absolutely.
yeah.
So then there are multidisciplinary approach. Like in our hospital, we run you through various other departments like the endocrinologist. If you have an endocrine problem which is unaddressed,
Like thyroid, diabetes.
yes. And then you have physicians who will look after your chest, and that you can undergo these surgeries. Then the anesthetist would look at you. And then there is a counselor. Diet counselor is the most important person.
True.
So they will start you on a diet so that your liver becomes normal and the risk of surgery comes down drastically.
So only after that these patients are actually taken in for
Yes.
surgery.
Yeah. So in that period of time, we'll give you about a couple of weeks. In that time, you have to make up your mind you're really up to it or not, because a lot of patients who by just looking at some ads or things would just call us up and tell us that we want to get surgery done tomorrow, and it's just that it's a thing that they have taken a decision right at the moment. They've not thought about it.
So they need to be prepared for
Yes,
such a
yes.
procedure.
So mental preparation is extremely important.
Yeah.
And the most important thing is then we hook them on to various support groups.
Yeah.
So they should know after the surgery what's going to happen, how these people are going to. So there are a few of them, like you sometimes they start having pukey sensation if they have taken a little bit bigger mouthful meal, and they're feeling low. Psychologically, or they're not able to, because initially they were all eating because of it gives them a sugar high, and now they're not able to eat, so a lot of them become very depressed, and that's where these social groups help them a lot. So we have social groups on WhatsApp, you have on Quora and all these places where I ask them to join. Then physically groups are also there where I tell them my patients to be connected with my older patients who would give them a lot of support in terms of it's going to be okay.
Yeah.
So that's enough for them. It's just a passing phase. You'll be fine. You'll be wait for some time. You'll feel awesome about it, and then the first thing comes that they start losing the waist size, and then looking at new
clothes.
It's always exciting.
Yeah, true. So what is the future of bariatric surgery and the treatment of obesity?
So lots happening.
Yeah.
Because billions of dollars are spent as we talk on treatment of obesity, which is non-invasive as well as invasive. So drugs, apart from semaglutides, similar drugs are coming in. and you are seeing more and more GLP analogs which are coming up, which are in pipeline, probably the last phase of their trials. So you're going to see in 2025 being flooded with all those
Yes.
medications.
Yeah.
And then there is I'm purely talking about the
Non-invasive. Yeah.
So there is the CRISPR. So CRISPR is basically the genetic modulation and genetic engineering. What you can do at the gene level, so
True.
that person starts to see food differently, the body starts to store fat differently, and the satiety centers are reprogrammed.
So these are newer innovations and technologies.
Yes.
How do you see obesity in the next 10 to 20 years?
Well, you are going to have a number of things happening. One is that you will have integration of these things.
Yes.
So you will never have a surgeon saying that, okay, this surgery is done and my work is on. So what you will have is more integrated approach to obesity. You will have surgery and medications as well as lifestyles. So a lot of AI and machine learning is coming into it. Typically, what's happening in our surgical field also. So we are doing a lot of these robotic surgeries. Now, robotic surgery has got a huge advantage over the laparoscopic surgery in terms of how we operate.
Okay.
And
can you give just 2 lines about the advantages of robotic surgery?
So robotic surgery is basically keyhole surgery, and we use a robotic console which has got a lot of machine learning and things like that to help us.
Yeah.
So for example, I'll tell you. So what's the difference between a laparoscopic
and a robotic?
Stapled and robotic is like a robotic surgery. The staples have got machine learning and AI.
Yeah.
So when we hold the tissue, it tells me exactly how much to press.
Yeah.
And it does it on its own. It assesses the tissue the size, the thickness, tissue, and it tells me that this is not the right staple to use. Use a different staple. So this kind of feedback is awesome, because what you're looking at is cutting down cutting down on all the risk factors that you are scared of. So as a surgeon, I'm very scared of leaks. So when you have this kind of a AI in my staple, I know exactly how much to do, and then we go on to use the exact amount of staples, and there are a number of staple sizes. So according to that, we keep on using, giving the patient the benefit of not having a complication after surgery at all. Then there is another thing called the firefly mode. So what it does is when I'm suturing, when I'm doing the anastomosis of the intestine with the stomach.
That is, you're connecting the intestine and the stomach.
Stomach and intestine to intestine and stomach to stomach. This firefly mode tells me how much is the blood supply of that area.
True.
So if the blood supply is good, then I don't have to worry about it. If it is less, then normal laparoscopic surgery will not pick it up. It looks pink, it looks nice on the table, but it is not really enough to sustain and heal it. But I'm 100% sure that it is the good blood supply, my staple length is good, and I can sleep well.
Yeah. So the robot is actually your 3D vision into the...
Yes. So apart from whatever, I mean, it's got a 3D vision, it's got a lot of flexibility, I can change. It works like my wrist, and it's a keyhole surgery. So basically...
But it tells you to go on dot into this patient.
Yes. So reducing the blood
loss.
Recovery is faster. I have little, complications. So a lot of things which are happening. Yeah.
So finally, what do you think people should take away from this podcast?
A lot of things.
Okay.
So
let's put it as 1, 2, 3, 4 under headings.
Yes.
Okay.
So the biggest thing that people should actually take it is that it is not all your fault.
Yeah.
So how it works is that obesity initially was a lifestyle disease. Everyone would say, because you're eating so much, because it's happening, that's why it's your issue.
Sometimes it may not be.
Yes.
Yeah.
So a lot of it's
Yeah, it's
always
on
like
your
this,
yeah,
actually.
yeah,
So what happens is you have to realize that it is a disease,
yes,
and a lot of these things are at a genetic level.
true,
Your cell size, your fat size, your genes are different. Your environment you're working is different. You're a techie who is working on the desk for a long time. You're working on different hours. You're working on US hours. So these things have to be realized, and you have to tell them that no, it's not your fault. Once you do that, what happens is it's not a stigma anymore.
true,
People will go ahead and ask for help.
true.
So instead of trying to say no, it's about my mental thing, and I want to cut down this, I want to increase. You get help.
Yeah.
And once you destigmatize it, people will take help, like the mental health issues which are there, but people don't look at it. So same as obesity. So that's one of the things that should happen immediately.
Okay, so basically the treatment options for obesity would be basically diet, exercise, then go to the medical aspect of it. If you're unable to do any of the above three, then bariatric surgery is there as an option.
Absolutely.
Thank you for this wonderful podcast, Dr. Mishra. Till we
Thank you,
meet
Dr.
again.
Anusuya. It's an awesome feeling that I've been able to tell something about obesity, which I know.
Yeah.
And we are able to help in a small way.
Great having you here.